You know, in nursing, our most powerful diagnostic tools aren't always the high-tech ones that beep or flash. Nope, more often than not, they're the ones we carry with us every single day, our hands. Today, we're going to unlock the art and science of palpation and really dig into how to turn your sense of touch into a precision instrument for patient assessment.
So, picture this. Your patient points to a spot and tells you it hurts right here. You look and you see nothing. No rash, no obvious swelling, zip. This is exactly where your hands take over. Palpation is all about learning the language the body speaks through the skin, sensing those subtle shifts in temperature, texture, and tenderness that tell the body's hidden story. It's how we find the clues our eyes just can't see.
So in this explainer, we're going to build up your palpation confidence. We'll kick things off with the basics, the what and why. Then we'll get practical with the techniques that will make you a pro. We'll even talk about what things like pitting edema or poor skin turgor actually feel like in our clinical examples. And then we'll wrap up with safety, common mistakes, and a super important exam tip you are definitely not going to want to forget.
All right, let's dive in and start with the absolute foundation. Why this skill is so crucial, and what exactly we're trying to figure out when we use our hands as clinical tools.
So what is palpation, really? Well, to put it simply, it's the skill of using touch to gather information. And as you can see, it's one of the 4 pillars of a physical exam, right up there with inspection, percussion, and auscultation. It's a very active, hands-on process of discovery.
What's really amazing is just how much data you can collect with just your sense of touch. I mean, think about it. Is your patient's skin warm and dry, or is it cool and clammy? That right there tells you a ton about their circulation. You can check their skin turgor, its elasticity, to see how hydrated they are. You can literally feel for the crackling of crepitation in a joint or the firmness of a distended belly. It's this huge spectrum of information, all available right at your fingertips.
Okay, so we know what we're feeling for. Now for the really important part, mastering the how. Let's get into the practical, step-by-step techniques that are going to ensure you're doing an effective and, of course, professional assessment.
Before you even think about touching your patient, these 5 steps you see here are absolutely non-negotiable. Hand hygiene? That's about protecting your patient, period. Warming your hands? That's not just being nice, it prevents the patient from tensing up, which could totally hide what you're trying to feel. And explaining what you're doing, well, that's how you build the trust you need to do a real assessment in the first place.
Now, take a look at this, because this is so fundamental. Palpation isn't just one thing, it's a 2-stage process. We always start with light palpation. Think of it like a gentle exploration, just pressing down about a centimeter. You're basically mapping the terrain, checking for any surface tenderness, texture, or temperature changes. It's only after that that we move to deep palpation, using firmer pressure to check out underlying organs. The golden rule is simple: always start light.
You know, your hand is kind of like a Swiss Army knife. Each part has a specific job. Your fingertips? Those are your high-resolution sensors, perfect for fine details like feeling for a pulse or a small mass. The back of your hand, the dorsal surface, has super thin skin, making it the best built-in thermometer for checking for warmth. And the palmar surface, the base of your fingers, that's what you'll use to detect vibrations, like something called a thrill over a dialysis fistula.
Okay, theory is great, but let's connect it to what happens at the bedside. Let's walk through a few real-world scenarios to see how these techniques give us critical clues about our patients.
All right, case number 1. You suspect your patient is dehydrated. You gently pinch a fold of skin over their collarbone. In a well-hydrated person, it'll snap right back. But if it stays raised for a moment before slowly going back down, you've just found poor skin turgor. And that's not just a small finding, it's a big red flag for dehydration. Your sense of touch just uncovered something potentially critical.
Now, let's flip to the opposite problem: fluid overload. You take your thumb and press it firmly into the skin over the patient's shin for about 5 seconds. When you lift it, an indentation stays behind. Think of it like pressing into a memory foam pillow. That right there is classic pitting edema, a telltale sign that there's extra fluid trapped in the tissues, which could point to heart, kidney, or liver problems.
And for our last case, your patient has some vague abdominal pain. You start your assessment, gently and systematically moving across the abdomen. You're watching their face, and then, bam! They flinch. They might even gasp. You've just found localized tenderness. You just narrowed a big, general problem down to a specific hot spot that needs to be investigated right away. That's the power of precise palpation.
Okay,
Using our hands to assess a patient is a real privilege, and with that comes a huge responsibility. So let's shift our focus to the things that are absolutely non-negotiable: safety, consent, and total respect for our patients.
These aren't just rules on a slide. They really are reflections of your role as a patient advocate. Wash in, wash out is about their physical safety. Asking for consent respects their autonomy. Stopping when it hurts shows them you're listening and that you care. And being mindful of their culture or past experiences shows that you see them as a whole person. This is how we create a space that's not just clinically safe, but also dignifying.
Let's be real for a second. Doing your first few physical exams can be pretty nerve-wracking. You're probably wondering, am I pressing too hard? Am I pressing too soft? What am I even feeling for? Trust me, that's completely normal. So let's go over some of the most common pitfalls so you can build your confidence right from the get-go.
So here are the big ones. To make it easy to remember, just WATCH, your technique. W is for warm your hands. A is for always explain what you're doing. T is for tender areas last. This is a huge one. If a patient says their right side hurts, you start on the left and work your way around. C is for comfort and privacy. And H, heed nonverbal cues. Sometimes, the most important information comes from your patient's face, not from what's under your fingers.
We're almost at the end, which means it's time for the big one. Seriously, if you remember nothing else about the sequence of a physical assessment for your exams and for your practice, make sure it's this. For pretty much every body system, the order is burned into our brains: inspect, palpate, percuss, auscultate. But, and this is a big but, there's one massive critical exception: the abdomen. For the abdomen, the order is different. It's inspect, then auscultate, and then palpate and percuss. Why? Because if you start pushing and tapping on the belly, you can stir up the bowel and create sounds that weren't there before, giving you a totally false reading. You have to listen first, while everything is in its natural state. Remember, IAPP: inspect, auscultate, percuss, palpate. It'll save you from a major assessment mistake.
And that's our look at mastering palpation. It's a skill that really is a beautiful blend of scientific knowledge and human connection. So practice it, refine it, and above all, trust what your hands are telling you. They are truly one of the most sophisticated and powerful assessment tools you will ever own as a nurse. So, what story will your hands help you uncover next?